If your gums have suddenly started bleeding every time you brush and you're pregnant, here's the first thing you need to hear. You have not suddenly gotten bad at brushing your teeth. Your body has changed the rules on you. Rising progesterone and estrogen levels during pregnancy make the blood vessels in your gums more permeable and exaggerate your body's inflammatory response to the exact same amount of plaque that never bothered you before.
Which is why even people with great home care suddenly see pink in the sink. A condition dentists call pregnancy gingivitis, and it affects the majority of pregnant women at some point.
For some, this shows up as more than just bleeding. A small, soft, reddish lump can form on the gum line, often called a pregnancy tumor. Even though it is not cancerous at all, it is just an overgrown cluster of blood vessels reacting to hormonal shifts, and it usually shrinks back down after delivery on its own. Here is where it gets serious though. Ignoring swollen, bleeding gums because you assume it is just a pregnancy side effect that will sort itself out is a mistake. Because researchers have found associations between untreated, more advanced gum disease and increased risks like preterm birth and low birth weight.
The theory being that the same inflammatory chemicals driving the gum swelling may circulate elsewhere in the body. And while this link is still being studied and is not proof that treating your gums alone prevents those outcomes, it is one more solid reason not to brush this off. Literally. Let's debunk some myths. Myth 1. Pregnancy makes you lose a tooth per baby. False and rooted in old nutritional myths, not biology.
Myth 2. Dental x-rays are too dangerous during pregnancy.
Modern shielded dental x-rays carry negligible risk when actually needed.
Myth 3. You should just wait until after birth for any dental work. Delaying necessary treatment can do more harm than the treatment itself. And while we are debunking things, let's kill the old wives' tale once and for all. The idea that you lose a tooth for every pregnancy because the baby pulls calcium straight out of your teeth is simply not how biology works. Your teeth are not a calcium bank. Your body can withdraw from the way bones are. The calcium your baby needs for developing bones and tooth buds comes from your diet and your skeletal stores, not from dissolving your enamel. So if your teeth feel more sensitive right now, hormones and potentially morning sickness are far more likely culprits than calcium theft. On that note, frequent vomiting exposes your teeth to stomach acid that temporarily softens the enamel surface, so brushing immediately afterward can actually scrub away that softened layer. A better move is to rinse with plain water or a pinch of baking soda dissolved in water right after being sick, then brush as normal a little later, once the enamel has had a chance to reharden. As for whether dental treatment itself is safe, yes, routine cleanings, fillings, and necessary procedures are considered safe throughout pregnancy, with the second trimester generally being the most comfortable window for anything elective.
Since the first trimester carries higher miscarriage risk unrelated to dental work, and the third trimester makes lying back for long appointments uncomfortable. But a genuine dental emergency should never be left untreated out of fear, regardless of trimester.
Dental x-rays, when actually necessary, use an extremely low dose of radiation and are performed with abdominal shielding, and local anesthetic injections at standard dental doses are also considered safe. Your dentist will simply be more selective about certain medications, favoring pregnancy-appropriate antibiotics and pain relief over options known to affect fetal development. The single most important action you can take is telling your dentist you are pregnant and roughly how far along you are at every visit. Keeping up your normal brushing with a soft bristled brush and fluoride toothpaste. Flossing daily, even if your gums protest a little. And not skipping your routine, cleaning out of unnecessary caution. Because consistent care now is what actually protects both your smile and your pregnancy, not avoidance. Let's answer some questions that are often asked. Question 1. Can I get a cavity filled while pregnant?
Yes, fillings are considered safe at any stage, with the second trimester typically most comfortable. Question 2. Will my gums go back to normal after I give birth? For most women, pregnancy gingivitis improves significantly once hormone levels normalize postpartum. Question 3. Is numbing medication for dental work safe for the baby?
Standard local anesthetic doses used in dentistry are considered safe throughout pregnancy. Thank you for watching until the end. Subscribe and stay tuned for more dental talks from ToothTruth.